So the question was from Paul Hamill at the World Herald. Now that Grand Island, just certainly on a per capita basis has more cases than Omaha, and you said that it was more like New York. I haven't done the math on that. Certainly it's more like New York than Nebraska. That's probably fair. Why did I reject the mayor's ask for a shelter at home? Actually, I got to tell you, in our conversations, neither the mayor nor the public health director directly asked me for that. I think that was done through a letter that they had, 45 doctors had put into the Omaha World Herald. But in our conversation, it was probably, a week and a half, almost 2 weeks ago now, when we were talking about steps to take, they didn't make that direct ask on it. And my subsequent conversations with the mayor, he's been grateful for the work that we've done to marshal resources to the public health district, to be able to do more contact tracing, the amount of testing we've been doing there. Obviously, Dr. Antone's been talking about how close contact we've had with the hospital and so forth. And again, I think that you look at our plan and it's working. Our plan is working. So we are not overwhelming the healthcare system, certainly not in Grand Island, as Dr. Antone just demonstrated, and nowhere in the state are we doing that.
Do you think, what else could be done in Grand Island, do you think, to address this?
So the question was, what else could be done in Grand Island? And one of the things we've done is I've reached out to the major employers in Grand Island. I've asked them to give me what are their plans, what have they done to be able to help keep their folks healthy and safe. What kind of communication are they doing to their teammates to let them know about things like, hey, if you're sick, you need to stay home, and everybody in your household needs to stay home. So again, so the goal for contacting those employers, the other employers, is just to make sure that they're all taking the steps to be able to do that social distancing in the workplace. So again, Grand Island's a manufacturing town, so it's not an easy place to be able to just work from home. Now, many of the employers are trying to get their folks to work from home where possible, but you can imagine in a manufacturing environment that's difficult. So that was just reaching out to make sure that those big employers were taking steps to be able to implement social distancing, just kind of a follow-up with that. So we wanted to make sure they were all doing that and encourage them to think about other ways that could be able to do it. So that's an example of one of the things we're doing. Another example that will not impact directly Grand Island, not just Grand Island, but is just what I just mentioned about trying to pull together all the food processors together in the state to be able to share those best practices. It's not really a competitive thing, right? To make sure everybody's doing what they can to be able to keep their teammates safe. So that's another step that we're doing, along those lines of making sure that we're doing all we can. I know other steps that have taken, we appreciate Dr. Grover has sent out communications through the school district to families. CHI has purchased advertising in multiple languages, both English and Spanish at least, to be able to communicate out. I know Teresa Anderson has done a lot of work as well about how to reach out to families who English may be their second language, and also communicating a way that is going to be more effective than maybe what I was doing through Stay Home, Stay Healthy, Stay Connected. So there's a number of things we've been doing to take those steps in Grand Island to be able to help educate people, to be able to help give them the tools they need to be able to do that social distancing and slow the spread in Grand Island. And as again, the things we are doing are working. We are, and just our call yesterday, I do a weekly call with all the public health directors. We do daily calls with them. Our team does daily calls with them. On one of the calls, I think it was yesterday, Grand Island said that at least, right now we asked specifically about PPE and their resources with regard to that personal protection equipment is adequate in Grand Island. So they're feeling, fine from that standpoint. We got testing going on there again. So we are paying attention to Grand Island. And again, we have not overwhelmed the healthcare system, so our plan's working.